Hello, this is Dr. Shilpi Reddy, Head of the Department, KIMS Cuddles, Kondapur. It's a mother and child center, specially for maternal and fetal care. So today we're going to discuss about high-risk pregnancy. What is high-risk pregnancy? For that, you have to know what is low-risk pregnancy. When you have a spontaneous pregnancy, which planned, unplanned, you've got spontaneous pregnancy and you don't have any medical disorders like anemia or any respiratory problems or any hypertension, diabetes, or you are above 30-35 years of age, then you are considered under low risk. So then what is high risk? High risk pregnancy is any pregnancy which had difficulty in conceiving, you had previous any miscarriages, your age is above 30-35 years, and you have medical related problems. So this is high risk pregnancy. Any pregnancy that has an associated factor, be it a medical factor or a social factor or a family history or anything that is related which will influence the pregnancy outcome, then you are considered to have a high risk pregnancy. If you have to talk about common symptoms of high-risk pregnancy, not much, but you will have either any medical related problems like diabetes, hypertension, any history of epilepsy or any history of any other medical conditions. It can be thalassemia, it can be sickle cell anemia, it can be any medical condition that can influence the pregnancy outcome. It can be even severe anemia, then you are considered to have high-risk pregnancy. It can also be previous miscarriages, or you can have symptoms of any cardiac problems, any neuro problems, or you can have symptoms of threatened miscarriage kind of symptoms with bleeding, spotting, or any other symptoms of impending any history of epilepsy, or any of your family history that suggests these kind of problems. The risk factors for high-risk pregnancy is a previous diagnosed medical condition, that's very important. Maternal age, which is more than 30-35 years. Definitely, if you are pregnant after 35 years, then it is called a little high-risk pregnancy. You can have symptoms and signs of threatened miscarriage like bleeding or spotting or any other issues related to it like that. And you have a pre-existing problem, be it a medical problem or a pre-existing surgical problem or a pre-existing history suggestive of previous miscarriages or difficulty in conceiving or an IVF or an IUI or a fertility treated pregnancy, that you can consider as the symptoms and signs. High-risk pregnancies are diagnosed purely based on history and your previous symptoms and signs. And once your diagnosis is made, you are definitely going to be under multidisciplinary team approach. That is usually possible in high-risk centers only. For any low-risk pregnancy, antenatal care can be given in a smaller setup, but high-risk pregnancies definitely need a center like Cuddles, where we have a physician on board, an endocrinologist on board, a cardiac physician on board, a liver specialist on board. Anything related to your metabolic parameters, you would be definitely needing a team approach in terms of management of metabolic problems and your other problems that need special treatment and titration. Be it simple diabetes also, you need an endocrinologist for proper management of medications. You need a team effort, a good dietitian, a good physiotherapist, a good Lamaze care specialist, a good antenatal team to guide you through pregnancy and give the optimum results of a healthy mother and a healthy child. So it's team care that is needed in high-risk pregnancy. A very efficient observing obstetrician is important, and the most important thing is you need a 24/7 obstetric care team along with the other specialities if needed. So it cannot be a clinic setup, it cannot be a smaller health center or a healthcare setup, or it cannot be a single speciality setup. Definitely you would need a multi specialty approach along with a high-risk center for obstetrics and a very good NICU care is mandatory for all high-risk pregnancies, because the chances of preterm delivery is little high in cases of diabetes, hypertension, previous preterms, previous unexplained intrauterine deaths and all that. So definitely you need a very good efficient NICU team to give you that optimum results of the outcome of pregnancy. With a wide variety of treatment options, the first and foremost thing is you have to be diagnosed. Diagnosis is very, very important. If you are anemic, your hemoglobin levels will show you have anemia. Similarly, if you have any hematological problems, your blood reports will reflect that. Similarly, if you have diabetes, your random blood sugars, your GCT and your GTT tests, whichever your obstetrician finds it in her protocol list, they will show you are having diabetes. Similarly, you are on any anti-epileptic medications, you are on any hypertensive medications, you need titration. So diagnosis is in itself the history of the patient. So once you are taken through the history taking process, your vitals, your primary investigations, the diagnosis itself comes forward, and you yourself will be diagnosed under a low risk or a high risk category depending on these particular things that give a clue towards the nature of the pregnancy. Precautions come in very, very early, because anybody with a pre-existing problem, for example, if the pre-existing problem is diabetes, your HbA1c should definitely be less than 6. Anybody who's planning pregnancy, that level is mandatory. Your fasting's less than 100, your post-meal 2 hours less than 120. That's the ideal thing. Anybody who's epileptic, then definitely your last episode should be more than a year back, and your control with anti-epileptic drugs which are safe in pregnancy should be on board. Similarly, antihypertensives also have to be changed in terms of giving the safe medication for pre-pregnancy approach. All pregnant women have to be on folic acid supplementation, good vitamin D supplementation and multivitamins, just in case if they have any other issues. If anybody is having pre-existing anemia or any other problems related to bloodstream disorders, you have to be supervised and brought to the normal values before planning pregnancy. So it's all about that your history gives an insight into the problems. You have to be rectified of all these problems. If anybody is having a recurrent pregnancy loss, you have to look into the reason for a recurrent pregnancy loss and have to be on medications subjective to that problem and the diagnosis that you've got. Similarly, anybody going through an IVF pregnancy or an IUI pregnancy, the protocol medications should be continued all throughout the first trimester of pregnancy. So whatever the pregnancy problems are, they can be managed very well. Definitely, you have to early diagnose, treat them as a specialty group, and high-risk pregnancy has to be treated well in a very good obstetric setup with multidisciplinary approach. So this is how a multidisciplinary approach gives good results, and the maternal health and the fetal health is of prime importance. So definitely, obstetric outcomes depend on the management protocols. An efficient obstetrician will definitely give you the desired results and a healthy mother and a healthy child. Thank you.